As patients come in complaining about facial lines, the most common area that they're talking about really is this parentheses area. We call these nano-labial folds, and they're very common because the fat that was up in our cheeks starts to droop and settle down at the same time that our skin is becoming more lax. So while folds here are quite common, children have them. As they become more pronounced, the shadowing and darkness and definition doesn't look good to patients. And we can use a number of hyaluronic acid products in this area with a duration of 1 to 2 years. We inject right into a small triangle to soften the fold. And in some patients, the fold is soft enough that we're coming close to smoothing things, and depending on facial anatomy, that may look fine. In other patients, we're taking a very sharp line and softening it by putting product in there. So the goal is to soften the shadow to make this look more natural and youthful, but not so full that it gives a stuffed look to the face. After treatment, it is possible to bruise, and we use ice immediately after treatment. We recommend no aggressive exercise or yoga with your head hanging down for a day or two, and icing off and on that evening to help prevent any bruising. And if you do bruise, we apologize, it will go away. You can cover it with concealer. It's common to feel a little bit of fullness, maybe a little bit of tenderness after filler is placed, and we like to bring you back at 2 weeks to see how everything has settled in. Filler does settle to the bony contours, and it will adapt to you as an individual. So at 2 weeks, if there's any unevenness or things feel a little bit funny to you, we can massage and contour to get it right where we want it to be. Usually we don't need to do much shaping of it, but it's possible to do that at 2 or 4 weeks. So we like to bring our patients back at 2 weeks. Make sure you're comfortable with the effect. Sometimes we'll say, well, it looks good, but we need a little bit more. So when we're using filler in the face, it's often a building project where we put a little bit in, make sure you're comfortable with the results, and then go ahead and add more to get the finishing effect. It's quite unusual, but occasionally someone will come back a few months down the road and say, something just feels a little bit funny in here. We can at that point still massage the filler, and if it's something that doesn't massage to our satisfaction, it's very easy with a small injection to reverse and dissolve that little section. Often we're placing the filler in long, thin lines rather than bubbles, and so it's unusual to have lumpiness here. But we do recognize that these things can occur, and we know exactly how to fix it if it does.